My name is Kathleen Heslin. My dog's name is Chandler Bing. He goes by Bing. I live in East Greenwich, Rhode Island. Bing is from New Jersey, so we call him our Jersey boy. We went and adopted him about 2 years ago. He has a sister named Phoebe, and they are fast friends. Bing is actually getting neutered today. It's been recommended to me. French Bulldogs have wonderful personalities. He is the best dog, but even at the age of 2, he still loves to mark his territory. And so I've had some guidance from the veterinarian saying that to have him neutered might actually help the situation.
Bing came in today for a neuter. He's 2 years old, and when we admitted him, what we do is we give him a sedation to make him a little sleepy, and then we can place an intravenous catheter, which we can then place the anesthesia, which makes him completely sleepy. And we shave up the incision area, prep it, we call it, which is surgically scrubbing it, getting it prepared sterilely for the doctor to make his incision.
Okay, so I'm going to put a catheter in, whatever front leg you want me to do.
Miss Lauren?
I'm just going to clean up the area. Are you ready for this?
It's okay, bud. What a brave man.
Good job.
Very brave.
Take that a couple times, make sure it's in secured. I can feel the flush going in, so we're good.
Okay. Get on your side, buddy.
Will you let us do this?
Okay.
All right, good boy.
So we're going to shave up the surgical area. Bing was extremely easy to work with. Usually, especially for his breed, bulldogs can be kind of crazy and rambunctious, so he was actually a really sweet boy and let us do anything to him successfully, so he was a good patient today.
All right, so I'm just going to place the trach tube. Right. Alright, so we can move right to the surgical room because I'll set it here.
Hi.
So when you neuter a dog, a lot of people, especially the guys, the male owners, they cringe a little bit. That's a big common misconception. If I neuter my dog, is he going to act like a girl, or is he going to act less macho? And that's not true. Okay, it helps with behavioral issues if they're marking around the house, but sometimes that it might not work because if that behavior has been going on for a while, that can be an issue. But it basically is good for them because they can't get cancer in them, right? So it basically it eliminates that factor. Another one is basically prostate hyperplasia, right? Their prostates when they get older, with the testosterone, it actually allows the prostate to get a little larger, can cause problems defecating, and can cause problems with urination. Most dog bites are from intact males, right? So it can decrease aggression. They're less likely to get hit by cars looking for a girlfriend. I feel that it's more of us being concerned versus the dog. The dog doesn't know any better, and it's not that big of a deal. Now I just organize my tray with all my instruments. Okay, let's go over the patient. I palpate the testicles so I kind of know where to cut. Okay. All right. So now, push the testicle as far up as I can, the pre-scrotal region. isolate it. Make an incision. Right over the testicle. Just enough. We can cut through the vaginal tunic, and I can squeeze it out. So I need to cut just a little bit more. And there we go. Extruded the testicle. Okay. And as you can see in here, we have our vessels, and we have our vas deferens, and our spermatic cord, okay? And this little membrane here, if it's thick and it's not ripping, you can actually give it a little nick with your curved Metzenbaums to loosen it up. Okay. Now what I'm going to do, it's called the 3-clamp technique. I use 3 clamps, proximal, middle, and distal. Proximal, meaning closest to the body wall. Okay. There's 1. 2. 3. These are very close together because at the end all I need is to just pass a blade to cut that apart. But this one right here, we're actually going to ligate, or we're going to tie off the spermatic cord, the vas deferens, and we're going to do it right here in the crush, which was created by these hemostats, okay? Do a surgeon's knot. Right down, right into that crush. I use a thumb-to-thumb technique to tighten it, okay? So you get pretty good tension on that area. So now when I actually cut these testicles out and remove them, we are not going to have any bleeding, okay, or any hemorrhage because we tied off those vessels. I'm going to take my blade, number 10 blade on the scalpel, and I remove it. Cut. Right through, away from the patient. There's the testicle. When the approach that I did on Bing is the pre-scrotal approach, and it's when I take the testicles and I push them up into the pre-scrotal area where basically it's before, if you're thinking where the penis is and then going down to the scrotum, it's before you hit the scrotum, right? So that's the pre-scrotal area. And it's an area of skin where you can actually push the testicle up above the penis, and you can actually cut over the skin, okay? And you know you're cutting over the testicle because it's right there, and then you just pop it out. And then I use the 3-clamp technique where I take 3 hemostats and I clamp it in basically proximal, middle, and distal. And then what I do is I make 2 ligatures around the pedicle, and then I basically ligate it, and then remove the testicles with my blade. And it's a pretty straightforward procedure. Could have, today it took about 15 to 20 minutes to do as I was describing everything, but it can be done faster than that for sure. But it's not all about speed, but it's one of those procedures which is a quick procedure. And there's minimal blood loss, so Bing, I didn't have to worry too much about that. And there we go. No more testicles. It's a little red, they'll be a little inflamed, but then it goes down and they'll be fine. Now the technicians will continue to monitor the patient. We can reverse this patient now with adipamazole, which is a partial reversal to the dexmedetomidine that we used for pre-anesthetic. It goes intramuscularly, and it's going to help this patient wake up a little faster.
Hey, buddy. You have the cocker lid right here. So just make sure you pull the tube before they actually start chewing on the tube. Good boy.
Good boy. We're waking up. Hello. The bad part's over. Yes.
Okay. We'll put him back in his cage. We'll get him an e-collar. so he doesn't lick at his incision site, and open it up. Okay, and then we'll monitor him and make sure he wakes up fully with no problems. Yeah. Okay. It's all over. It's all over, buddy. You did good. You did a good job. Hello. Okay. We'll see you in a few minutes.
Yeah, he was a great patient today, and no complications. Everything went well.
Hey, buddy, how are ya? Oh, how you doing? Oh, such a good boy. Such a good boy.
So you want to keep this on until his recheck appointment, so he doesn't look at his area.
Okay. All
So
right.
it looks as if he still has some, but that's just inflammation and whatnot. There you go.
Okay.
I promise you. Yeah.
Oh, Phoebe will be excited to see you. All right. Well, thank you so much. I appreciate it.
A glimpse into the owner's soul is through their pet, I feel. And when you get to know their pet, you kind of already get to know what they love, the owners love, and you can feel the love, and you kind of get to know the owners just by kind of, indirectly, vicariously through the pet, so I love just every aspect of my job because there's so many different tangents you can go off. But ultimately I think this is it's the profession for me because my love for animals, and when I can show that to them, it becomes reciprocated. Oh guys, thanks guys. Can I get up now and hurt them?
Yes. Go. Oh, hey, Too much left, 2 months.
2 months.
I think I made my point. I won. Alright, I won. Oh my god. Oh, you did that. Who won? I won.